हेलो गाइस, तो आज हम लोग नर्सिंग एप्टीट्यूड का चैप्टर 3 स्टार्ट कर रहे हैं। चैप्टर 3 इज क्वालिटीज़ ऑफ प्रोफेशनली क्वालिफाइड नर्सेस एंड टॉपिक आर दीज। नाउ स्टार्ट चैप्टर। Nursing is a highly respected and noble profession that requires not only dedication and commitment but also a high level of professionalism. A professionally qualified nurse is someone who has undergone formal education and training in nursing and has acquired their nursing knowledge and skills to provide quality care to patients. In this chapter, we will discuss the qualities of professionally qualified nurse that are essential for success in his field. Now topic is compassion and empathy. Compassion and empathy are crucial qualities that professionally qualified nurse must possess. Nurses work closely with patients and their families, and they must able to show the empathy towards their patients and understand their needs. Compassion is the ability to care and show concern for the well-being of others, which is an essential quality for any nurse. A nurse who is compassionate and empathetic will not only provide physical care but also emotional and physiological support to their patients. For instance, a nurse who understands the fear and anxiety patients may feel before a surgical procedure will take the time to explain the procedure in detail, answer their questions, provide reassurance. A compassionate nurse will also show empathy towards a patient who has received bad news and offer emotional support during the difficult time. Next topic is knowledge and competence. A professionally qualified nurse must have the necessary knowledge and skills to provide quality care to patients. This includes having a thorough understanding of anatomy, physiology, and the principles of nursing care. A competent nurse must also be able to apply this knowledge in practice situations and adapt to changing circumstances. For example, a nurse who is caring for patient with a chronic illness must have a good understanding of diseases processes, the medications used to treat the illness, and the potential complications that may arise. The nurse must also be competent in the use of medical equipment and be able to respond quickly to any changes in the patient's condition. Next topic is professionalism. Professionalism is an essential quality for any nurse. It encompasses many attributes including responsibilities, accountability, and ethics. A professionally qualified nurse must always act in a manner that is consistent with the standards of the nursing profession and adhere to the ethical principles of the profession. For instance, a nurse must respect the confidentiality of patients' information and ensure that patient privacy is maintained. A nurse must also be aware of their limitations and seek guidance from a more experienced and colleague or a physician when necessary. Next topic is communication skills. Communication is an initial aspect of nursing care. A professionally qualified nurse must have excellent communication skills to be able to interact efficiently with patients, their families, and other healthcare professionals. A nurse must be able to convey information accurately, listening attentively, and respond appropriately to the needs of their patients. For example, a nurse who is caring for a patient, a language barrier must be alternative methods of communication such as interpreter to ensure that the patients receive the necessary information about their care. A nurse must also be able to communicate effectively with other members of their healthcare team to ensure that patients' care is coordinated and delivered in a timely manner. Next topic is critical thinking and problem solving. Nursing care often involves complex situations that require critical thinking and problem solving skills. A professionally qualified nurse must be able to assess a situation, identity a problem, and develop a plan of care that addresses the patient's needs. For instance, a nurse who is caring for patients with multiple chronic conditions must be able to prioritize the patient's needs and develop a care plan that addresses each condition. The nurse must also be able to recognize potential complications and take appropriate actions to prevent or manage. topic is attention to detail. Attention to detail is a crucial quality of for a professionally qualified nurse. Nurses must be able to identify subtle changes in a patient's conditions that may indicate a problem or a potential complications. A nurse must also be meticulous in their documentations of patients' care to ensure that all important information to recorded accurately and in a timely manner. For example, a nurse who is administering medications for a patient must pay close attention to the dosage or routine of the administrations and potential side effects of the medication. The nurse must also document the administrations of the medications in the patient's medical record to ensure that other healthcare professionals are aware of the medication's regimen. Next topic is cultural competences. In today's diverse society, cultural competences is an essential quality for professionally qualified nurses. Nurses must be able to provide care that is sensitive to the cultural beliefs and practices of their patients. This includes understanding the impact of culture on health beliefs, communication, and decision making. For example, a nurse who is caring for a patient from a different culture background must be aware of the patient's beliefs about health, illness, and respect their cultural practices. The nurse must be also be able to communicate effectively with the patients, their family, and members, taking into account any language barriers or cultural differences. Next topic is leadership skills. Nurses are often in position of leadership and must be able to manage and delegate tasks to their other members of the healthcare team. A professionally qualified nurse must be able to demonstrate leadership skills such as effective communication, problem solving, and decision making. For example, a nurse who is in charge of a team of nursing assistants must be able to delegate tasks effectively, provide guidance and support to the team, and ensure that patients' care is delivered in a timely and effective manner. The nurse must also be able to make decisions quickly and make appropriate actions to the errors that arises. And next topic is adaptability and flexibility. Nursing care is often unpredictable, and nursing must be able to adapt to changing the circumstances and handle unaccepted situations. A professionally qualified nurse must be flexible in their approach to care and be able to adjust their plans needed. For example, a nurse who is caring for patients who suddenly experience a change in their condition must be able to respond quickly and take appropriate action addresses the patient's needs. The nurse must also be able to adjust their care plan based on the patient's changing needs and communicate effectively with other members of the healthcare team. In conclusion, a professionally qualified nurse possesses a wide range of qualities that are essential for success in this field. These qualities include compassion and empathy, knowledge and competencies, professionalism, communication skills, critical thinking and problem solving, attention to detail, cultural competencies, leadership skills, and adaptability and flexibility. These qualities are necessary for providing quality care to patients and for ensuring that the nursing professional remains a respected and vital component of the healthcare system. Moreover, a professionally qualified nurse must be communicated to lifelong learning and professionally development to stay up to date with the latest advancements and best practices in the field. With the combination of these qualities and ongoing professional development, nurses can provide high quality care that meets the needs of patients and families and communities. In addition to the above mentioned qualities, a professionally qualified nurse must also adhere the ethical standards and principles. Nurses have a unique responsibility to advocate for their patients and to ensure that their rights are protected. They must also maintain patient confidentiality and respect the privacy of patients and their families. Furthermore, nurses must also work collaboratively with other healthcare professionals, including physicians, therapists, social workers, and other members of the healthcare team to provide comprehensive and coordinated care. They must also be able to communicate effectively with patients and their families, providing clear explanations of their care plan and answering any questions they may have. One way that nurses can demonstrate their commitment to ongoing professional development is by pursuing additional education and certification in a specialized area of nursing. This can include obtaining a master's degree in nursing, obtaining certification in a specific area of nursing such as critical care, oncology, or pediatrics. These additional credentials can help nurses to advance their careers and to provide specialized care that meets the unique needs to their patients. In conclusion, a professionally qualified nurse possesses a unique combination of qualities that are essential for success in this challenging and rewarding field. By demonstrating competence and empathy, knowledge and competencies, professionalism, communication skills, critical thinking and problem solving, attention to detail, cultural competences, leadership skills, and adaptability and flexibility, nurses can provide high quality care that meets the needs of patients, families, and communities. Additionally, by adhering to ethical standards and principles and pursuing ongoing remain at the forefront of the nursing profession and provide the best possible care to their patients. It is important to note that the qualities of a professionally qualified nurse are not something that can be learned overnight. They are developed over time through education, training, and hands-on experience. It takes a great deal on dedication and hard work to become professionally qualified nurse, but the rewards of the profession are immeasurable. One of the most rewarding aspects of nursing is the opportunity to make a positive difference in the lives of patients and their families. Nurses are often the first point of contact for patients and are responsible for providing initial care, support, and comfort during some of the difficult times in their lives. Nurses have the unique ability to develop close relationships with their patients to provide personalized care that meets their unique needs. Furthermore, nursing is a profession that offers a wide range of opportunities for career advancement and specialization. Nurses can choose to specialize in a particular area of nursing, such as pediatrics, critical care, or oncology. They can also pursue advanced degrees in nursing, such as master's or doctorate degree, which can open an additional career opportunities and increasing earning potential. In conclusion, the qualities of a personally qualified nurses are numerous and varied. They include compassion and empathy, knowledge and competencies, professionalism, communication skills, critical thinking and problem solving, attention to detail, cultural competences, leadership skills, and adaptability and flexibility. These qualities are essential for providing high quality care to patients and for ensuring that nursing profession remains a respected and vital component of the health system. With ongoing professional development and a commitment to the ethical standards and principles, nursing commitment to provide the best possible care to their patients and make a positive difference in the lives of others. Now chapter 3 is completed. If you like, then like, share, and comment, and subscribe my channel for more videos like this.